first of all, I've used secondary mental health services for 44 years. I was in a long-term hospital in 1970 in London. I come to Manchester in 1985. I'm an ex-member of the Mental Patients Union. That was not only in London, that was Manchester as well. And now we could do with it back again, actually. What I see at the moment is really, really frightening. People are dying. The last two of my friends passed away. I can remember one of them who started the same day at me at Harper Day Centre. Didn't reach pension age. In 1992, there was 4 or 5 people when, I don't know if people remember the situation with James Ito, that said basically when a severe mentally ill person was accused of murdering a husband on a train in Finchley Park. She said, wait a minute, you've got 2 victims here. You've got my husband and you've got the mentally ill person, and the real murderers is the NHS. And through that led, she went around the country and we had dispatches. But the other 4 people that was on dispatches, they're not here now. They're dead, you know? They're dead. They didn't leave the pension wage. They died because of neglect in mental health services. What I see today, especially with benefits, from a user's point of view, are they mark free. Work makes you free. The thing is, as we go back to Nazi Germany, the mentally ill, Adolf Hitler said they are unfit to live. That's what his law was. But when I look at the benefit system, and I advocated someone, and he went to Atos on his own because he had no support, no nothing. Not only did he have severe depression, he had learning difficulties as well. So when he comes to this other unqualified staff, he didn't understand what she was talking about. He had no money, his landlord was about to evict him. And I was told to apply for job seekers allowance. When he went to make a working contract, no way could he understand the contract. And it's quite obvious that what they said were, if you don't do this, you don't find a job, you don't look for a job, which he just did not, just not well enough, his impairment was not very good, he would have had no money, they would have stopped his benefit. That person would have been homeless, he probably would have died, And this is happening all the time, it's a real big threat. What's the difference when you stop giving, by this monetary system, money to live on, which the Nazis did? Where's the difference? It's not a big difference, is it? Going back to Manchester, one of the things we're finding very hard as users is not only the cuts, it's the dishonesty. Our latest, we're just beginning to get our campaign underway. In fact, our chair is actually devising online, is the petition. But we didn't know about this till last Tuesday. The council wants to do away with Recovery and Connect, and that's nearly £1 million, £913,000 of savings. We didn't even know. No one told us. No one from health. No one from the local authority. I had to sort of get onto the councillor involved. No one told us about meetings. No, nothing. As if we were starved of information. So we went down Channel, there's about half a dozen service users from our users group. We went down Channel, and the thing that really, I was biting my lips were bleeding because of the lies by the chief executive of the trust. Nigel claimed at that meeting, and at these meetings you couldn't sort of stand up and say, wait a minute, it's a liar. She said 95% of users think our service is marvellous, high standard, you know? And I've never seen anything like it. We've had lies. I questioned on board level our chief executive, saying, well, we've got money, we're not in debt or anything like that. Then there's a letter saying, we ain't got much money, we've got to do this, we've got to do that. And if you look on the web, I think it's on our website, isn't it? And to see the dishonesty. The fact is that what it affects is the mental health teams. Already, you know, I'm under the mental health team. If my mental health team goes sick, tough. I'm left to my own devices, you know, and I get ill. Things that I'm suffering from, I've been diagnosed as schizoaffective. You know, I hear voices, I go up and down. I've even been told that you're right from suicide, Alan, because you go past suicide. You freeze up altogether, urinate yourself, and therefore that's it. But more and more people, and I can understand the staff, they're under such a lot of pressure. You know, my daughter is now in an occupational therapy herself, and it took me a long time to understand from their point of view what they go through. And I'm learning that they're human beings, and they, you know, the amount of stress they're under is tremendous. It can't carry on like this. How will it affect? These are services, the community mental health team have these support workers from Recovery Connect. I was talking to a manager, I can't give you his name because he actually felt threatened, but he gave me information. He said, well, Alan, he said, we're going to have to discharge more ill people from the mental health team. And you're going to have less support. I said, hey, less support, you'd be non-existent, you know? And you also got, you know, one of the actual centres, when I come to Manchester in 1985, one of the services that is so valuable to me, I'll never forget it, was Harper Day Centre. They really looked after me, you know? That is completely gone, you know? Even with this cut, they have the Recovery Connect based at Harper and you know, when they go, there'll be nothing at all. And people have actually come up to me crying in tears that used to go to Harper Day Centre. And they're saying, we want our day centre back. We want our life back, you know? So you can see the frustration. You've got the Horticultural Centre, again, Recovery and Connect. And these patients are long-term patients. They don't want to get a job, you know? Some of them are over pension, or some of them are under pension age. And some of them, you know, they're never going to work. But the most dangerous thing of all is when they do get discharged, or the new technical term, step them down, you know, is absolutely terrible. I've been told to wind up, so I will wind up. Before I wind up, you know, I would say for service users and their support workers, you know, you need to lobby the councillors. The councillors think we don't exist and we're all loonies and we won't speak up. We will be making a list of local councillors and people to phone. We need help, but it's also these NHS people that are on hundreds of thousands of pounds, right, taking all the resources and your life's away from you. So I'm going to, you know, I end up now with just what I was saying. If you remember what Tony Blair said, education, education, education. I say, action, action, action.